Welcome to Texas A&M Corpus Christi College of Nursing and Health Sciences. We're pleased that you're considering a position as clinical faculty for our nurse practitioner program. Working with nurse practitioner students can be very rewarding. If you haven't ever taught nurse practitioner clinicals or are new to the college, a short presentation will describe the responsibilities. The first thing that you're usually asked to do in the semester is to read and approve preceptor contracts. These contracts and agreements are submitted by the and they're submitted to the clinical faculty, who then read them, approve them, sign them, and then submit them electronically to the college. On the course you're assigned to, your students may be on campus on one Saturday for a seminar. Usually this is with Advanced Health Assessment and Differential Diagnosis course. The adjunct faculty will be working with their students on that day, and it's usually on a Saturday. Go to their clinical sites and work with their preceptors. After their clinical day, students will create a clinical log in Tyson and also write SOAP notes. So you know that the nurse practitioner educational model for the United States is based on preceptor model. And so your students will have a preceptor and they will go out and work a certain number of hours in clinics with their preceptor. Clinical faculty will read Tyson entries. These Tyson entries are the clinical log of patient visits when students go out to these and work at these clinics with their preceptor. Here's an example of a log. The student will enter in all the information about their patient and the visit. They'll do diagnosis codes, and they'll put a short SOAP note at the bottom. It's very short. Then clinical faculty will have a chance in here to give feedback and write their own notes, and also to approve these entries. Once the entries are approved, then the hours are added onto the student's time, and they receive credit for the time that they spent with the patient. It will also track the type of patients they're seeing, the level of complexity, also the age ranges of those patients that they're seeing. Students will also create SOAP notes as an assignment within the course. Within the course, students are told they need to write a SOAP note for each note that they're in clinical. Clinical faculty will read the notes and then give feedback on these assignments to the students. We access these notes as we go into our Blackboard course, and then they'll either be in the grade book, and this is an example of the grade book, and it has a little exclamation point there, and that's a link to the document that the student has uploaded. Or else sometimes they're sent through mail, Blackboard mail, and sometimes through your Outlook or your personal email, however it is that you communicate with that student. Some courses do require that they be uploaded into the course so that there is a consistent record for the student of feedback. A feedback stream. You can see how we can type a little note here, and we can also download the file to our computer, write comments or additions to the note, and then upload it back here. So that's really good feedback, and it helps the student progress in that skill. Clinical faculty will be making site visits to each student. And you will go out to the site and you'll visit with the student, and during this visit you will see several patients with the student. You'll go into the room with the student, and then you will give feedback to the student on what you saw, and they'll collaborate also with the preceptor. So you want to spend some time talking to the preceptor. These site visits usually take anywhere from 2 to 4 hours, depending on how long it takes you to get there and how easy it is for you to get in to see the patients, how complex the patients are. After you do your site visit, then clinical faculty will prepare a student evaluation form with formative feedback. And this feedback is intended to help the student improve their clinical performance and skills during that semester. So they get this feedback usually before midterm or by midterm, and they have the whole rest of the semester to make those improvements and respond to your feedback. And there's just a sample of the start of a form. On the second page will be narrative, where you can write in any concerns or anything that you saw that was that you want to talk about. Good or, you know, sometimes it's positive, sometimes it's encouraging and them to make some changes. At the end of the semester, the students, preceptors, and faculty complete end-of-course evaluations. And the clinical faculty will review these documents and submit these electronically in a compiled format to the College of Nursing. The responsibilities of nurse practitioner clinical faculty, kind of in a nutshell. If you're interested in having more information, or you need to, or you would like to apply to work with nurse practitioner students, please contact the College of Nursing and Health Sciences graduate program, and then you can get more information there.